Hey everyone, it's Sydney. I am the 2020-2021 Director of Health and Wellness, and today I am here to talk about Diabetes Alert Day. So Diabetes Alert Day is a one-day event where we raise awareness for diabetes and focus on the seriousness of the disease and all the different risk factors that come along with it. Diabetes mellitus, more commonly referred to as diabetes, is a condition in which one has elevated blood glucose levels. These elevated blood glucose levels can lead to detrimental effects such as damage to your heart, your nervous system, eyes, blood vessels, and other organs within our body that can lead to overall a state of poor well-being. Most of the food we eat is converted into glucose. Glucose is a simple sugar that provides our cells with energy. The pancreas is an organ in our body. One of the main jobs of the pancreas is to create insulin. Insulin is extremely important in regulating blood glucose levels and making sure that we get the right amount of this sugar into each of our cells. Diabetes can result from insulin deficiency or a form defect in the insulin response mechanism. Today, I'm going to be talking to you all about type 1 diabetes and type 2 diabetes, but before I get into that, I want to talk a little bit about why diabetes is specifically important to our community. Let's talk some stats. So diabetes is an extreme public health issue. Diabetes impacts over 34.2 million Americans, that's about 10.5%. The rate of diabetes in Louisiana is the 5th highest in the country. During the COVID-19 pandemic, it was found that diabetes, specifically type 2 diabetes, was the leading condition, the leading underlying condition in patients who unfortunately passed away from COVID-19. Specifically, there's a higher incidence of type 2 diabetes in the Black community. This is attributed to things such as social determinants of health, things that include income, education levels, access to adequate health care, community and environment, as well as lifestyle choices. So first, let's talk about type 1 diabetes. Type 1 diabetes is often seen in adolescence. It's diagnosed earlier on in life. It's due to an autoimmune destruction of beta cells. Beta cells are found in your pancreas and they are involved in creating insulin. So these patients are specifically unable to create insulin, which means they're quote-unquote insulin deficient. A lot of these patients will focus on maintaining their blood glucose levels, maintaining a proper diet, as well as exercising regularly. Now, let's talk about type 2 diabetes. So type 2 diabetes accounts for over 95% of people that have diabetes. Type 2 diabetes is characterized by insulin resistance. Most people who have type 2 diabetes have a syndrome called metabolic syndrome. Metabolic syndrome is simply an umbrella term that refers to a number of different health ailments such as obesity, hypertension, meaning high blood pressure, high blood sugar, and of course, insulin. How can we be stronger than diabetes? 1, be well, know your BGL. BGL stands for your blood glucose level. It's really important to get tested for your blood glucose level, as this can indicate if you are at risk for developing diabetes, also known as being pre-diabetic. This is really important as you can't simply see if an individual may have diabetes. 2, know your family history. Ask your mom, dad, uncle, aunt, cousins to see if they have diabetes or if diabetes runs in your family. This is extremely important as some people can be genetically predisposed to type 2 diabetes, as well as type 1 diabetes. Both type 1 and type 2 diabetics should talk to their healthcare providers about treatment for their diabetes. Specifically for type 2 diabetes, it's really important that you make lifestyle changes. I know it's hard for a lot of people, but maintaining a moderate weight is so important. Now, you don't have to go crazy, but you do need to get some more movement added into your daily routine. Something as simple as taking a walk, going on a bike ride, taking the stairs rather than the elevator is so crucial to your overall health. Additionally, it's important that you make some dietary changes. Make sure that half of your plate consists of vegetables, fruits, and that a quarter consists of lean protein and the other quarter of whole grains and other healthy carbohydrates. Remember, you deserve to live a long life, a legendary one, and of course, a healthy life. So take control of your risk and the potential of, again, developing diabetes.